Hello brothers and sisters, welcome to my channel. If you are new, please don't forget to subscribe. This is Uncle Lenny, and you know the goal of my channel is to highlight every single business in our community. Let people that are coming out of town get to know the services that we are offered in our community. So today, I'm somewhere in Wexford at a clinic course. So this is where I am, guys. Today, I just wanted to take you in a tour of this wonderful clinic in Wexford. In case you're wondering where you can find a clinic, yes, we are located over here. So this is how it looks like outside. Shortly I'll take you inside so that you can meet the people that are doing what they're supposed to do inside. And this, in case you are on Perry Highway, and this is the place. You're gonna find this billboard. You're gonna find that place right there. Right there, right there. This is where this place is located. So here we go, you come. You come pass over this place and you make a stop sign over here, and this building looks like this. So guys, this place has got a very qualified doctors. They are specialists. So they are specialized in pain management. They will treat every single pain. You work so hard. Hello, brothers and sisters, we are still over here. I said we wanted to make sure that we show everything that the community offers. So right now we are still at the clinic, and this is what is happening over here. So come along. When you come over here, you can find all the information. This is the information desk. This is what is happening over here. And over here, as you can see, guys, this ANODYNE pain and awareness solutions, it's located in Wexford. And these are the services that you can find when you come over here. They completely manage the pain. Anything else that you really need, it's right over here, guys. You can see, if you're a man and you're having dysfunction, of course they'll do a lot of, they're going to go over here. It's done. Here, at the pain and awareness. Guys, right now, I'm going to have to let you in, take the CEO of the company to show us what is going on.
Welcome to ANODYNE of Wexford.
All right.
Please come on with me.
All right, welcome to ANODYNE of Wexford. My name is Adam, and this is Alice. So thank you, Uncle Lenny, for coming to visit us today. We're very, very grateful for what you're doing for the African community. For promoting the businesses and African businesses. We believe that it's time for Africans to make an impact. So thank you so much. So we'll go on a very quick tour of the clinic, and if you have any questions, you can ask us, and we're happy to answer. But this is ANODYNE Pain and Wellness Solutions of Wexford. We're a walk-in clinic. We are a non-opioid, non-surgical medical facility for treating acute and chronic pain. You know, medication masks your pain. So when you come here, we get to the bottom of the situation, we try to get you out of pain. And we'll show you how we do that. All right. So why don't we take a little walk around?
So guys, I want to make sure that, I want to tell you that my mind right now is blown out. I can't believe it. That we are at this clinic that is owned by an African. By the way, are you African for sure? Doctor.
Yeah, we're from Ghana.
Hey,
yeah.
We are so grateful. Guys, we need to support one another. The goal is to making sure that we highlight every business. So in case you're from somewhere else out of town and you are wondering where you can find a help, let's support our African business. So today we are over here with the doctor of our own, all the way from Ghana, but we are all one people.
That's right.
So guys, this is how we're gonna start, right?
Yep. So this is our waiting area. As you can see, we try to keep it we can try to have a wellness feel here. Okay. So that when you come here, you're very comfortable. So we have a few chairs, and then we have this side waiting area. Our receptionist area is over there, which is essentially our nurses' station. Okay. So we have a nurse here. When you call, you can actually get to talk to a medical person right away. It's not just somebody who picks up the phone. Okay. There's a nurse that you can talk to.
Wow,
Go ahead. I'm sorry.
This is beautiful. I can't believe this. Oh my God! Look at this, guys. Look at this. This is of high standard. I don't know what you're looking for. But honestly, when you come over here, you can feel that part that this is of a high standard. So guys, we have to make sure that we support our own businesses. The doctor, you're showing us around.
Yes, I am showing you around. So the first place we're going to see is, let's look into like the reception area, what it looks like very briefly. Okay. So I'll let you come in here. This is our nurse's station. Wow. It's very simple, but the nurse is here. She can see whoever's coming in. and then she's able to monitor everything that's going on in the back.
All right.
So in the back over here is our physical therapy room. So we have everything you need to work on you from a physical medicine standpoint.
Okay.
So we have this table where the doctor can kind of monitor, basically check you out.
Okay.
The little machine here is a stim machine.
Okay.
Let's say you need some stimulation in your knee or your back or whatever it is. The machine will help out. If you have to get on the treadmill, we have it here. If you have a problem with your knee and say you can't walk, but you have to get on a treadmill, this is the bike that you can sit.
Wow.
This machine here is called a vibration plate.
Okay.
It's like the easy way to work out. You can go ahead and stand on it.
All right.
It's like an easy way to work out. Let's say you can't do the treadmill, you don't want to paddle. This machine, you can actually, it's like a easy way to work out. It spins you around, and then you're essentially working out your body.
Yes.
In a very simple way.
Ooh.
Right? And what it does is it basically vibrates the body, so it helps with lymphatic drainage. We have toxins in our body. This actually pulls the toxins to a place where you can actually.
Guys, I can feel it.
Yeah, you feel it. You feel it a little bit.
I can feel it.
I'm gonna stop it so we can go on.
All right.
So we have the freezer here. We keep our cold packs in there if you need a cold treatment for your condition.
Okay.
We have the hydrocollator here if you need heat.
Okay.
To help, because there are conditions that you need heat to treat and conditions that you need cold to treat. We have both.
All right.
Okay. Going ahead, this is our conference room in the clinic.
Yes.
Where we have our meetings. We have provider meetings every day.
Okay.
Once a week, we have our staff meeting. So this is where we do that.
Okay. This is where the boardroom is.
Yep, exactly.
Okay.
Okay, so as we go, this is our, the board over here is the list of services that we offer.
Okay.
So we offer acupuncture, IV infusion, chiropractic, and we'll look at the different rooms that do the different things. But essentially, this is the list of services that we offer at the clinic. Okay? So do you have any questions at this point, or can we keep going?
Yeah, we can keep on going.
Okay.
Yes.
Okay. So this is what the hall looks like.
This is where.
This is what the hall looks like. This is where all the medical happens at.
Guys, this is how everything looks like.
It looks like. But we're gonna go from room to room. So our first room here is a red light therapy room.
Okay.
So red light is a photobiomodulation therapy.
Okay.
That you use to basically improve the health of your mitochondria. Okay. So what you do is, what happens is, you get in the bed, the red light that comes from this machine goes into your cells. Right? It goes straight into your cells. Okay. And then it heals you at a cellular level. Okay. So if you have pain, if you have arthritis, if you have any kind of situation, you can look on the board. These are the things that you can treat. Okay. You have a wound that is not healing. You have skin condition that you want to clear. Yes. You have chronic pain. And then you have arthritis.
I'm gonna go in.
Okay, go ahead.
He has to go in, has to try everything.
Yeah, Agalani can wear his goggles. Yes. And then give it a shot.
Guys, I'm over here. I need to try.
So essentially what you do is you lay down, it's not warm, it's just nice, comfortable feeling. So you put your head down slowly. Yeah, and then it's not gonna close all the way. So that's okay. You're good. And then you stay in here essentially for just 15 minutes. And what you're doing is you're improving your cell metabolism. You're improving your function. Let's see how he looks like inside. You're looking good, man.
I'm looking good, right?
You can raise your hand or something.
Yeah.
Yeah,
you're looking good. Wow. So yeah, you lay in there for 15 minutes. You do this for 15 minutes. Yes. And then you get out. All right. The goal is to do it for 2 to 3 times a week. And then if you have pain in your body, it will help the pain. You heal the pain at a cellular level. Wow. If you have these conditions, it's a modern technology. Wow. So it does help quite a bit.
Hey guys, these guys, it's so nice over here. I don't know, I'm from Zambia, I've never seen anything like this. But one of our own is holding it in America. I can't believe this. Wow. Ooh.
Okay, so we'll turn that off now.
Ooh.
And then once you're done, yes, it goes into the dirty bin so that nobody uses it twice. Wow. And so we have this disinfected. Okay. All right.
Well, thank you so much.
You're welcome.
Ooh,
So the next room here is our consult room.
consult
So
room.
basically a patient comes in,
Yes.
and then we call, this is where they come.
Oh,
the
okay.
doctor brings them in here, and we check their eye, their ears to make sure everything is fine, their blood pressure. And then the machine here is a 3D body scan.
Can I stand?
Yeah, you can stand
Ah,
on
yes.
it. The 3D body scan. The 3D body scan is our machine that we do provide weight loss, medical weight loss here.
Okay.
Right? So the 3D body scan gives you a baseline of where you are. Okay? So this machine right here takes about 500 to 600 photographs of you.
Okay.
And then creates a 3D image of you.
So
it measures the size of your biceps, thighs, and everything. Go ahead.
Hold on. Yes, sorry to cut you short. You're talking about weight loss.
Weight loss.
You mean I've seen so many of our people saying, this is January, I need to try to cut this. So this is where you can help them to manage how they can cut and how to balance the body, the weight loss?
Yes, we can definitely help you. Obviously, we'll help you with what you have to eat, because you have to eat better. You have to exercise a little bit, but then we'll also give you injections that can help you. We have the red light that helps with weight loss. We have the lymphatic machine that helps with weight loss. So let's give this a shot. Let's see. So you can stand.
Guys,
then,
this is what is going on.
So you want to take a photo of the video on there? Yeah.
So this is slowly gonna go around
Okay.
whilst this takes pictures.
All right.
Okay. Yeah.
So
we have to stay away from the camera. Yeah, step back a
follow
little
the
bit.
instructions.
Yes.
When it turns green, that means you.
All right.
you
Bingo.
Yeah.
Starting Staiku in 3, 2, 1. Scanning your body now. Please hold still.
It's happening in America, guys. Right here in Wexford. I don't know what you're looking for, but here you get everything. When you are strong, you can go and look for money, but when you are weak, you can't do it. So I encourage you to come over here, make a stop. All right.
Body scanning is now complete.
So it scans your body. We'll hit the demo, but what we'll do is we'll go around and then hit continue. By the time we come back, it would have
Your
finished
scan
processing,
is currently processing,
and then we'll come and take that
will
look
be
at your
available
image when you
to
come
view
back.
All right.
just
Okay.
All right. Thank you so much.
Yeah, you're welcome.
Thank you.
So, but if we need to take a normal measurement of your scale BMI, if we want to take a normal height and weights and measure, this will just a simple one will do it. But that machine you just got off
Yes.
will give you way more metrics from BMI to your blood, everything.
Yep.
It just measures everything that is in your body
Mm.
and gives you metrics. So let's say you're trying to build biceps.
Yes.
And you know, it might not show up on the scale right away, but this shows you progress. You're trying to lose weight. It might not show up on the scale right away, but it will show you specifically the size of your let's say your hand, and then the next time if you're making progress, it shows you all that.
All right. All right. Wow. Wow.
So this next room is what we call, this is where we do our spinal decompression.
Okay.
If you have back pain, sciatica pain,
All
pain
right.
shooting through your legs,
Okay.
and maybe they tell you have to do surgery. This is something you can try because we're a non-surgical facility. This is something you can try. You can actually lay on it.
All right. Let me lay on it.
Yeah, you can lay on it, and I'm not gonna stretch you out.
Okay.
But then essentially you lay on it,
Yes.
and then we strap you up, and then what we do is once this is on, we stretch you out a little bit.
Okay.
So what it does is it kind of stretches your spine a little bit and lets oxygen into your spine.
Into my spine.
And lets your spine breathe a little better. So if anyone out there is struggling with back pain, sciatica pain, pain on the side, pain in the thigh, this machine could potentially help you out. So you could come in and then we'll consult with the doctors, and then we'll see if this can prevent you from getting surgery.
Wow.
Because recovery from surgery is an issue,
Yes.
especially for the elderly. So we want to make sure that we do everything we can so we don't go to surgery. If you have to go to surgery, you have to go to surgery.
You have to go.
But try one or two things before you go get cut up. Okay?
So brothers and sisters, you have to come and try before you are looking at going to do the surgery. There are means and ways on which you can avoid the surgery. And the surgery is more expensive. I would rather you try first over here to see if you can manage your pain. They are doing almost everything here. I don't know what pain or what is bothering on your body, but it's very important, guys, to get checked. Get checked with the doctors. We have our own doctors in our community. That's the reason why today we just wanted to make sure that we highlight what is it that is being taken care of at this clinic. Guys, doctor, you're showing us.
All right, so the next room we have here is our chiropractic office.
Yes.
And so I know most people know about chiropractic.
Yes, yes.
You can actually lay down.
Oh, yes.
Yeah, chiropractic is essentially, you can actually face down.
Face down?
Yeah, I'm not a chiropractor, but I'll show you what they typically do.
Yes.
Yeah, you face down. And then what they do is essentially, they work on your back.
Yeah.
This is your spine right here. We have a scope that detects like the sitting of your spine.
Yeah.
And if anything is not in place, right?
Yeah.
If anything is not in place, he's going to work on that for you. If something is crooked, he'll straighten it for you. If one leg is longer than the other, he'll work on it for you. Now, let me do a quick test on there's a massager that he uses sometimes to help the people. So I'm going to do it on the top portion of your shoulder, okay?
That's fine.
So this is what it does.
Oh, that feels good.
It relaxes you a little bit. And then if you need any part of your body that needs relaxed, this will do it for you as well. Okay?
Wow.
Okay, one more thing.
Yes.
There is another type, if we want to do like a deeper type of massage, we can actually use this, and I'm going to do it on the same shoulder side, okay?
Okay.
This one works on the shoulder. If you have like very stress on the shoulder, it'll do it for you. It'll basically help reduce that.
Wow.
Okay? So anyways, this is, you can come in here if you have any back pain.
Yes.
Any kind of back pain, we will assess you, and then the doctor will work, the chiropractor will work on you here.
Guys, we work so hard. You work so much, you need to find time and just come and lay down over here. Just get some massage. My God, you don't even know how it feels. It feels so good. I think I have to make a trip again on my own to have that massage more.
Definitely. So our next room here,
this
is our procedure room.
Okay.
This is where any medical procedures are performed.
All right.
So two of the big things we do here, one is hormone replacement.
Hormone replacement.
You know, hormone regulates your body. Right?
Okay.
And a natural course of hormone function is after a little while, the function goes down. And then you potentially, you could potentially fall into Alzheimer's, also, dementia. Those are natural stages of life.
Yes.
What hormone replacement does for you is essentially boost your hormones back in your body.
Yes.
So it puts you back maybe 20 years back.
Okay.
So you can feel energetic, so you can get out and do things with your grandchildren, with your children. It gets you out there.
Okay.
And especially for the women, if you're in menopause, or you're having hot flashes, and you're just so discomfort in the body, hormone replacement essentially brings you back to like a premenopausal state where you don't have the cranky attitude all the time. And you're happy, and so we use what we call pellets.
Okay.
So you get a pellet in your body. It's a simple 5-minute or less procedure. You come, you get the pellets. And for women, it's usually 3 to 4 months before you need it again.
All right.
So every 4 months, say you can come boost your hormones, and it's bioidentical, which means it's not medication, it's not like opioid at all. It's a bioidentical, which is it works with your body can recognize it, so it doesn't hurt your body in any way.
So doctor, yes, I know you. Today I'm learning so much. I'm learning so much all these medical terms, but with all these services over here. What kind of insurance do you take?
So we're still working on the insurances, right?
Yes.
Right now we take Medicare.
Okay.
We're halfway through Highmark.
Okay.
And then we take TRICARE. Hopefully in the next few months or so, we'll be able to take most insurances. Okay. The UHC, the UPMC. But for right now, if you have Medicare, Highmark, and TRICARE, you can come and we can work with you. But if you don't have insurance, even if you don't have insurance, especially for our own people, right? You can come and then we'll take care of you. We'll do a cash deal for you. You can pay. We just want people to be healthy. Because like you said, when you're healthy, you can go make money. Right? So we'll treat you. This is a clinic. It's a walk-in clinic. We're open Monday, Wednesday, Thursdays for walk-in. You can just come in. If you're sick, not too far away, come in and we'll basically treat you, and you pay just a little bit of cash.
If you don't have money, we have finance.
Yeah, so I mean, we provide financing. If you have to do a procedure that costs money and you want to do it, we have financing companies that help us. And then, you know, just come. I mean, if you're an African, come. We'll figure something out. We'll work with you.
Brothers and sisters, look at the services they offer here. If you don't have money, they'll connect you to the money part. Whatever insurance you have, they're going to work on it. In case we come from a continent where we don't make an appointment to the clinic, and this is exactly how it is. You just wake up, you have a headache, you go and see the doctor. Guys, find time just to visit this place. That's the reason why today, you may think there's nobody else. We came in on the day off so that we keep the privacy of people. So that's the reason why we are here. Doctor, you're going to show us again.
Yeah, there's one more thing we do here which is very important. We do wound care. We do advanced wound care. So if anyone out there has a wound that is not healing, like diabetic foot ulcer, like a pressure wound, a surgical wound, any kind of wound, if you do like a C-section or something that is not healing, and it's just you're just frustrated, just come. We have a way to treat it. We use advanced placenta-based graft to treat these wounds. Wounds that don't heal for months can potentially be healed within 6 to 8 weeks if you use the right things. So you come, we'll figure it out, and then we'll finally get you out of pain.
Wow.
Yeah.
Brothers and sisters, if whatever you have, any wound that is not getting better, find yourself over here in Wexford. Doctor will take good care of you.
Yeah. And this is the office for our chiropractor.
Okay.
And I just want to show you this. This is where we do injections.
Okay.
And I'll let Alice talk about the injections. Oh, you want me to talk about it? Okay. So she's a medical person, but this is where we do injections.
All right.
So let's say you have knee pain.
Yes.
And maybe it's bone on bone.
Okay.
So you do need help. You do need some gel put in there. We do injections here for the knee, for the hip, for the back. And then for the shoulders, we do that. So this is the room where we do injections. Now, this is a C-arm.
Okay.
The C-arm helps us do guided injections. So what that means is where the needle is going, the doctor can see where the needle is going live on this TV.
Wow.
So that whatever money you pay, you know the medicine is going where the pain is. Because you don't want a situation where you pay all that money and then the medicine goes here and the pain is here.
Wow.
Now this machine is a fluoroscopy machine. It helps us guide where the needle goes so the medicine goes exactly where the pain is.
Wow.
Yeah. So knee pain, back pain, shoulder pain. We can treat you with a red light. We can treat you with chiropractic. And if you need injection, we can bring you.
Hey, guys, you know why I'm laughing? I'm so mind-based. You can even see where the needle is going. Only. Oh, guys, doctor, I'm speechless. Honestly, I'm speechless to see one of our own owning a business like this, where if you have a pain, you can see where the medication is going. I'll let you still going to explain for us. I don't want to just come in and catch you.
Two more rooms. And so over here we have, this is our x-ray room. Okay. So we have x-ray on site. All right. So when you come in and you have an issue, we want to treat you while you're here. We don't want you to send you out, go and take an x-ray and come back. Come back. We do the x-ray right here, and then we'll treat you right here. Wow. If you go to a normal hospital, you may have to jump from one place to another, and then maybe you have to go do MRI. So we keep x-ray on site, so that we do the x-ray.
That's the beauty of this place, because you pretty much, you come in, they'll gather everything. Yes, you don't have to say, come next Thursday when you bring the x-ray. So when you're over here, if they want to check about you, what is going on, what is wrong with your body, your x-ray are done right on the site. You come in.
And we show you your results right here in this room.
Wow.
You don't have to go and come back, and there's no film. This is a digital x-ray. So we take the x-ray, and you see it right here on the screen. And then the doctor can show you right here what is wrong with your back. The same time.
The same time.
You don't have to go and come back.
Wow.
We show you right here and here. And if you need your blood drawn, we have a lab. Okay. Here. So once again, you don't go out for x-rays. Yes. You don't have to go out for labs. We can draw your blood right here. And we can draw your blood, and then we send the blood draw to Quest or to LabCorp. As you can see, we're connected with Quest and LabCorp, and then one more other lab. But we'll send it out. So usually what happens is the patient will come, the patient will sit down. Yes. And our nurse will draw the blood, and then we send it out. When the blood work comes back, and then we'll treat you.
Wow. So brothers and sisters, everything else that you need, it's done right over here. If they tell you you need the blood work to be done, they'll just stop taking you on the side. The madam here will take good care of you. There are nurses that are over here, qualified nurses and doctors that are found in this location. Don't just say, oh, well, we are African. No, 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 no. We have a specialized doctors on this location. It's just that today it was a day off. Just for the sake of this video, that is the reason why it was just set, just making sure that we showcase every room in this place. Doctor, you're taking us up.
Okay. So we have just one more room. This is our medical provider office. We're not going to go in, but this is where the medical provider sits.
All right,
Okay.
all right.
So the next room here, this is a special room. It's a muscle treatment room.
Okay.
So if you want to point the video on this one, if you have any pain in your neck, your shoulder, your elbow, your back, your hand, your knee, your ankle, if you have pain on any parts of those points, and you come in here, we will try to identify the root cause of that pain, and then we will fix it. Now, another thing we do here, which is very important, is erectile dysfunction. And this is for our brothers who have erectile dysfunction. Now, I know Africans sometimes get embarrassed about erectile dysfunction.
That's exactly.
But erectile dysfunction, for the most part, is cardiovascular. If it's about blood flow.
Yes.
If the blood is not flowing to your private area,
yes,
you have to be concerned.
Yes.
Because then the worry is eventually the blood is not going to flow to your heart.
To your heart.
So if you have erectile dysfunction, you need to take it very seriously. Because the blood flows through the body. And you want the blood to flow, you don't want it to become a cardiac issue, a heart issue, right? So you come and we use this machine. This is an acoustic wave machine.
Okay.
What this machine does is it sends shock wave into the affected area. For erectile dysfunction, we send it into your private area.
Okay.
And what happens is this machine sends the shock wave through and then breaks things down a little bit there.
Okay.
And then it creates what we call angiogenesis. Angiogenesis is the rebuilding or the recreation of blood vessels and tissues. So we look at this, for example, and then this is an example of blood vessels that are like weak and gone, pretty much gone. Now, if you're not getting blood flow into your private area, you're not going to get functionality, right? So this machine sends the shock waves through. And then over time, we normally do 6 to 12 treatments when you have it, depending on your score of severity of erectile dysfunction.
Okay.
And then after the treatment, look at that. It builds the blood flow.
Okay.
Once you have blood flow, you have functionality.
You're good to go.
And blood is flowing into your private area, and it's flowing into your heart. It's flowing into where it needs to go. In the process, whilst this shock wave or acoustic wave is fixing that, it's also breaking down plaque. So it clears your veins and vessels, I believe is what it is, your arteries. It clears your arteries for the blood to flow through. So when you have erectile dysfunction, don't be embarrassed because you don't want that to become a cardiac issue. Get it checked. And if you're on Viagra or Cialis,
yes,
it might help you get functionality from time to time. But what you really need is blood flow.
Yep.
You don't want erectile dysfunction to become a cardiac issue, a heart issue. Get it checked, and we have a way to fix it. Yeah.
My people, this topic is not a big topic that we talk most of the time. We normally keep it as a private, but this is a medical issue. We don't need to rush to look for someone else who's going to Africa to say, can you bring me something over that side? We can always be fixed over here. Find yourself over here, the doctor will take good care of you. I mean, we are talking about dysfunction without knowing that it can even cause cardiac arrest. So something that you take as small, it can end up to be big. So I want to encourage you, brothers and sisters, especially my brothers, stop by. As we age, certain things start to slow down, but we don't have to start feeling imbalanced. Let's come and talk to the doctor. We'll be back on the move. Doctor, thank you so much.
Yeah, you're welcome. So we have just one more room and we're done.
So
All right.
just one more thing.
Yes.
So using this machine, just so you all know,
Yes.
this really works.
Okay.
We've used it on about 6 people so far, and it all worked. We've not had any complaints or anything. It worked for them.
Okay.
So if you want to come, please come. And then for our brothers and sisters, if you think you don't have some things to come to the hospital, just call us. You can call our personal cell phone number. We will get you in. If you call the front, normally they are white people, and you think, oh, I'm afraid they're gonna, all questions, and you think you cannot answer, just call us personally. We will get you in. You don't have to have everything. And also, talking about insurance, if you think your insurance, you're not sure if we take it or we don't, just call us. We will check for you. We are here to take care of you. And then also, you'll be happy. We will be happy together. We will all be happy. So we will be happy to also have you here to see you and then take care of you. I'm happy.
So, Mama, I know I don't want you to run away. You didn't even give out your phone numbers.
I thought you were going to add it on the screen.
Yes.
You can just put it on the scrin whilst we are talking. Right?
Yes.
I can still say it. Our number.
Yes.
It's not local. It's not Pittsburgh number, but it's Ohio number. My personal cell phone number is 937 609 3832.
All right.
Number
yes
is 412-912-1100.
All right.
Now you can call the front.
Okay.
And they are very nice people in the front.
Okay.
But if you really want to talk to one of us,
yes,
Alice is our medical. She's our clinic manager.
Okay.
Just call Alice, and we'll give you our brothers and sisters VIP treatment.
Doctor, you are showing me something on that machine.
Yes.
Yes.
Let me show you this. So on this machine, you can bring it closer. This is the machine that actually, if you have a problem with your thigh, if you want to get it closer, or you're good. Okay. So if you have a problem with your neck, shoulder, all of that, we just use this machine to treat that. Let's say you have a problem with your shoulder, right? And we're treating it. This is how we'll treat it. We'll treat it. It shows the provider exactly what to do. And then we'll just identify the problem areas in the shoulder. Yes. And then we'll treat it. The same machine is what we use for erectile dysfunction. Okay. Let's say most people in their foot, because some Africans work and they walk so much, yes, they end up developing like pain in the heel. Now, that pain in the heel could potentially be plantar fasciitis. Okay. Usually we just think it's pain in the heel, right? Yes. But if it's plantar fasciitis, we need to fix that pain in the heel. And the way we treat it with this shockwave machine. We get into the heel, yes, and then we send the shock waves into the heel. Like I said, yes, it creates angiogenesis. So it will rebuild the tissue. If you have a torn Achilles, you have a tendon torn, you have vessels torn, this machine has a way to rebuild, to help. The shock wave will help rebuild tissues and tendons in the area so that you can heal permanently. Wow. Yep. So brothers and sisters, you can see when you're in Africa, we send people to India for services like this. But right now you're over here. We are in Pittsburgh, guys. Make sure you come and get checked. Don't just wait until when the condition gets worse. I will encourage you to find time, not just be at work. When you are off, drive in, just get checked. It's very important. The doctor will tell you the benefits to go and visit the doctor than just going to the doctor when you are very sick. Yep. Doctor, thank you so much. You're still showing us. Yep. There's just one more room and we're done. All right. Okay, so this is the hall going this way. All right. Yeah. The middle here, like I said, is our admin area. Okay. So yeah, we have marketing and all that sit there. Wow. This is the final room, and I'll wait for him to get it. So this is the final room. This is our IV infusion room. Okay. So you can actually sit. Oh wow! Most of us actually in Pittsburgh. Yes. You'll be very surprised. Over 90% of people in Pittsburgh. Yes. Are vitamin D deficient. Because the sun doesn't really shine for a long time. When it shines, you don't get what you need to get. All right. So if you need, let's say you're tired, you're fatigued, yes, right? And you want to just improve your metabolism, or you just feel lethargic, you can come, we'll give you an IV infusion for that. All right. If you need detoxification, with all the toxins, Pittsburgh is essentially still a blue-collar place, right? Yes. So with all the toxins in the body, you can go, take supplements, or you can actually just come and then we'll do IV infusion for you to detox your body. Another thing is, let's say one night you get drunk by mistake and you have to go to work the next day or something and you're just feeling terrible. We have an IV infusion that will hydrate you and that will take the hangover off. We have different cocktails that treat different things. And for those women or men that have wrinkles on the skin and they want to help reduce the wrinkles and reverse anti-aging, we have some IV infusions that can do that for you as well. So, so the IV, we have the poles here in the IV infusion room. What we also have is while you're getting your IV infusion,
yes,
we have this little machine here that massages your eye.
Oh, really?
And then you turn it on.
This on, it plays music.
Wow.
And then this part will massage around your eye area.
Let's test it.
And then you feel all relaxed whilst you're getting infused.
Yeah,
I
let's
can,
test it.
yeah. Uncle Lenny is trying it today. I've never had this, guys.
So, make sure it's comfortable on your head. Yep.
You can adjust it.
Oh, okay.
Yeah.
So you should feel the massage on your eye while you're getting IV infusion to help your body heal.
Wow.
It tightens a little bit and it releases a little bit, but then you should feel like a cool sensation on your eye. You know?
Wow.
And he plays music on it as well, so at least to get you comfortable. The goal is to get you comfortable, while you're getting healed from inside.
Wow.
Yeah. So, you have any questions on it?
Doctor, this is nice. I feel good, you guys. You have no idea what I'm seeing today, but I want to encourage you so that you can try for yourselves. Uncle Eddie just came out this afternoon just to showcase, to show you. It's so comfortable. You can even go to sleep, though.
Yeah.
So you can even go to sleep. So if you're taking the IV, guys, it's like more like you're doing it at home. You're so comfortable. It's so comfortable. Even my eyes, you know, that I can feel the massage of my eyes. And this, we should be all proud that one African did not come to America just to work, but is an investor into this land. So guys, I want to encourage everyone, wherever you be seeing my video, tell a friend about this place.
Alright, so we all do. No, usually after that, then we sanitize it and it's all ready to go for the next person.
Alright.
But this is pretty much it. And
wow.
Thank you so much for visiting ANODYNE Pain and Wellness. We are very, very grateful for taking the time to come and for spending some time with us.
Doctor, before we conclude, Madam Alice, do you have any last words to our viewers if you're going to speak to them right now?
Well, so far he said it all, but I'm happy you are here. Thank you so much for coming. We really appreciate this. We are doing this to help our community and also our African community. Please feel free, come visit us, come see us, call us anytime.
Thank you so much. And doctor, anyway, last words as we conclude?
Yeah, so first of all, thank you for coming. I think it's a great thing you're doing for the African community. Now, our brothers, especially to the brothers that have any issue with men issue, or you know, somehow we can handle pain, come, we will help you. Erectile dysfunction, come, we will help you. If you feel fatigued, that you can't function as a man, like going out mowing the lawn, come, we can help you. This is a place where we put together to help everybody, especially our own people. So come visit us and call us personally if you have to, and we'll get you in and treat you well.
So brothers and sisters, we have come to an end of this video. I just want to encourage you to talk to one another. Talk to your friend. Let them know where we are located. Let them know about this clinic. Let them know about where you can find help. In case you just move into town, this place is on the other side of town. I think it's on about 25 minutes away from downtown.
Yeah, about 20 minutes.
About 20 minutes away from town. And basically it's not that very far, but I want to make sure that you guys, you share my video, talk to your friend, leave a comment in the comment box and let me know which country or which county you'll be watching this video from. We're on the move to showcase our businesses in our community. Thank you so much. I love you all.